888-270-9933.
Call now if you have a question. But first, we want to talk about some new research while we wait for your calls to clear about a link between weight loss and lower breast cancer risk for women after menopause. Hi, Zorba.
Hi, Zorba.
Hi, good to see you guys.
So tell us about this study.
Well, it's a study of the Nurses' Health Study. This is a long-term study, one of the major studies that have really been going on for the last 20 or 30 years. And researchers publishing in the journal Cancer looked at women who had breast cancer, 60,000 women who had breast cancer, women who didn't, and they looked at weight. They looked at women whose weight was stable, women who gained 5% of their body weight, women who lost 5% of their body weight. And they looked at it over a 3-year period. In other words, did you lose weight over a 3-year period? Did you gain weight over a 3-year period? Or did nothing happen? And lo and behold, they found that there was a 14% drop in breast cancer in women who had lost just a little bit of their weight over a 3-year period, 5% of their body weight. That is a huge difference. Now, we've known for years that being overweight is associated with breast cancer, but this is the first study to show that losing weight might reduce your risk of breast cancer. And I think that's really important information, especially for anyone who has breast cancer in their family or anyone who really was looking for another motivation to lose weight. Clearly, losing weight seems to be one of those factors that may reduce your risk. It's a very important study. Observational, we can't tell for sure that's what it's doing, but the fact is it's very, very likely that weight loss is associated with a reduction of breast cancer.
What is the connection there between overweight and breast cancer?
Well, we don't really know, but it probably has a lot to do with estrogen and estrogen receptors in the body. We know that some breast cancer is estrogen sensor sensitive. That's actually most breast cancer. And we think that women who are overweight, just like they're more likely to get diabetes because they are insulin resistant, may also be estrogen resistant. So it may just be that. And we know that being overweight is associated with heart disease, high blood pressure, and so on. So it's just another risk factor with weight gain that we don't understand very much about. We just know it's important to try to get that to that ideal body weight.
All right, interesting.
Very interesting.
All right, let's go to the phones. We'll start with Jean in Partyville. Hi, Jean.
Hi.
What's your question?
Dr. Zorba, I'd like to know if detox teas are really beneficial or if it's just a waste of money.
Well, it depends on how much you spend on it. Now, if you're getting an inexpensive detox tea, that's certainly fine. There's no evidence, no scientific evidence that detox teas do anything.
What is it? I don't know
one
what
of the
it
things
is.
that, well, they're called detox teas to get rid of the toxins in your body. And there's, the FDA has said you can talk about it as long as you want to, as long as you never define it. You don't define toxins in your body. You just say they're toxins. If you say it reduces the risk of breast cancer and you a little bit flow on the edge of what the FDA allows and does not allow. And the problem is a lot of this is pseudoscience. They'll say, wait a minute, this has been shown to reduce breast cancer in this person and that person, when reality is there's no science involved. So I always recommend save your money. If you want to have a good tea, buy a tea that you like.
All right, good advice. Let's go to Dick in Avalon. Hi, Dick. What's your question?
I have a ruptured disc in my lower back and a lot of arthritis, and a regular doctor doesn't want to do surgery. And I was wondering what he thinks about having laser surgery.
You know, the first, second, and third thing about low back pain or even upper back pain is to really get onto an exercise program with physical therapy. And the problem with exercise is that many people start an exercise program 1 week and they stop the exercise program 2 or 3 days later. In other words, it's really hard to do that. The first thing I always tell people with low back pain or neck pain is do an exercise program from a trainer or a physical therapist, which is even better. Be 90% compliant and give it 8 to 12 weeks. Once you do that, let's see where it is. So if you've not done exercise, the right exercise for 8 to 12 weeks with a physical therapist that really invented it, then the fact is you haven't really given conservative therapy the biggest risk. Laser surgery, surgery is surgery is surgery. It's the last thing we want to do with backs. The first thing is exercise.
All right, let's go to Larry in Madison. Hi, Larry.
Hey, how are you?
Good, how are you? What's your question?
Well, I think I just heard some of the answers from Dick.
You got some lower back problems, too.
Oh, my gosh. Yeah, I'm on my feet 6-7 hours a day, and I'm 70 years old.
Wow.
And, I've been doing some stretching. I've been I tried to do this plank thing, you know, on my kitchen table, not on the floor. And it seemed to help a little bit to strengthen
But I'll
my
tell you
back.
something, Larry, to give you some advice. Go to a physical therapist once to learn how to do the right exercises. Do a second time to go back, because you'll forget half of what they tell you the first time. Then you'll have the right exercise program. And that's the way to do it. If you just do it happenstance, a little bit of here, a little bit of there, if you still have back pain, it's not necessarily well designed. That's what you need. You need a personal evaluation, and that's how you do that's the best way to do it.
All right, Larry, Dick, you got your answer. Zorba, thanks for being with us.
Great to see you, Zorba. Thanks so much.
Pleasure to be here.
Thank you all for calling in. We'll do it again soon, and we'll be right back with the final check of your forecast.